If I talk about the scenario of type 1 diabetes in India, it is very challenging. We know a large number of people in India, especially children, they are living with type 1 diabetes, and an estimate says that we may be having around 15 to 20 lakhs people, including children, living with type 1 diabetes in India. If we talk about the care of type 1 diabetes in India, it is a challenge because if a large number of people with type 1 diabetes, they are not diagnosed correctly. Once they are diagnosed, it is very difficult to maintain and keep up with the treatment, because the treatment requires multiple daily insulin injections, regular monitoring, and sometimes use of advanced technology as well. So many a times these people are not able to get adequate care, and they suffer from the complications of type 1 diabetes. Type 1 diabetes requires mainstreaming into current health system. There may be 2-3 points. One is that all the doctors, they must be educated and trained in care of people with type 1 diabetes, including healthcare professionals at the primary care level also. Secondly, the patient education is very, very important, and the patient should be educated about the importance of monitoring and managing type 1 diabetes, importance of monitoring blood glucose levels, the how to administer insulin, how to take insulin, how to monitor the doses of insulin, and how frequently they should go for the checkup and all. So these are the two key areas, and involvement in the key government health policies, because the government can do a lot in reaching out to the masses and developing it into a policy, so that all the medical colleges and the institutes, they are able to follow it. So people with living with type 1 diabetes, or person having a living experience of type 1 diabetes, I will say they are important. They are very, very important when it comes to policy making, decision making for the people, for care of people with type 1 diabetes. And I believe we should have an all-inclusive platform where we can include not only the healthcare professionals, the researchers. We need diabetes advocates, we need people living with type 1 diabetes, their parents, their families, so that everyone can become a part of this movement, leading to a better and advancing the care of type 1 diabetes in India.